Hello, it's Dr. John Longfree, Senior Vice President of Work Care. I'm an occupational and environmental medicine physician. Today, let's talk about coronavirus 19. This will be video 1 of 4 on that subject. But first, a little bit about myself. I spent some time traveling in China in 2003, all throughout China and Tibet. And there, during that time, they were having the SARS outbreak. So I'm a little bit familiar with that. Our company was involved in the anthrax scare of many years ago. We also were involved in the Ebola virus remediation efforts in Texas when that went through parts of Texas. And we do other things of a similar vein over the years. We're an occupational medicine consulting firm. And we help employers deal with things that can hurt employees in the workplace, essentially what we do. Getting down to it, what are some symptoms of coronavirus 19? Well, it's in many ways it's a typical respiratory virus. It's just a little more aggressive in certain populations. So you have all the same sort of usual symptoms. You might have a fever, you might have a cough, you might have a little bit of shortness of breath. It doesn't mean that if you have those that you have coronavirus. You might just be coming down with the flu. You might be having a little bit of bronchitis. You might be having a totally normal sort of illness that you might see that is not coronavirus 19. So just be aware of that. Not all coughs are coronavirus. It may be allergies. We're seeing allergy season start up now, so just be aware of that. Not all coughs are coronavirus necessarily. So those are the main symptoms. Sometimes it takes a couple of weeks for those symptoms to manifest in someone once they've sort of contracted the virus. Therefore, we have people quarantined for about 14 days if we think they might have been exposed. That's where that 14-day number comes from. In general, people get over the illness. They can completely clear the virus from their system, and they are immune after they've recovered from the virus. So there's a possibility of that. Speaking of that, we may want to touch upon how do you prevent yourself from even contracting it to begin with? Well, obviously, to get the disease, you have to get the disease. You have to be exposed in some way. So one of the ways to prevent that, of course, is you can completely quarantine yourself. But again, we all live in a society, so you have to go out and do things in the world. So if you have to go out, like most of us do, I would advise you to wash your hands frequently. There's a way to properly wash your hands that you learned when you were young, and I would ask you to do that. That involves scrubbing your hands with warm soapy water for 20 seconds or so, rinsing them thoroughly, and then making sure you dry your hands thoroughly. If there's doorknobs in the bathroom, feel free to use a clean paper towel to open the door and so forth to get out. Air dryers that we sometimes talk about, so those hot air dryers are not recommended for this situation. It is thought that they may blow the virus off of the hand and into the air and thus aerosolize it. There's only one study that I could find that sort of asked that question. Most of those studies are on bacteria, so who knows? But in general, a clean paper towel is probably the best. Make sure that your hands are dry. Don't touch your mouth, your nose, your eyes, and so forth. You can transmit the disease, we think, from your hands to those body parts through touching and so forth. Keeping that in mind, we talked about now the symptoms of the disease, how to prevent it, including quarantine, as well as some simple personal hygiene related issues. Now, the question comes up frequently about masks and should you wear a mask. In general, masks are thought to protect to prevent the person who's ill, in other words, who's symptomatic, from spreading the disease. The masks are not intended for you to prevent yourself from getting the disease. So that is why we typically are not recommending masks, and neither is the CDC in Atlanta. They're not recommending masks for otherwise asymptomatic healthy people because, again, you're not coughing, you're not blowing your nose, you're not sick. But if you do have the illness, it might behoove you to wear some sort of respiratory protection so you don't infect other people. So that's that on, and how about medical gloves and things like that? Well, that's fine. It wouldn't hurt, but in general, medical gloves are probably unnecessary in most situations as long as you're not touching your face, mouth, nose, and so forth. People with gloves on still touch their faces. I know that may come as a surprise to you, but we used to see that in the hospital all the time. So anyway, just be aware of that. Face shields are probably most important if you're, again, we're talking about outside of the hospital setting. If you are at risk of touching your face or touching your eyes, it'll just prevent you from doing that. But in general, the face shields are unnecessary in most cases. There's lots of opinion on that, and I believe that there's no reason to wear excessive PPE even when servicing a hospital elevator. Now, of course, we'll talk about this in later videos, but certainly you can wipe down the areas of the elevator with an approved disinfectant that you'll be frequenting. Of course, if you're down in the basement area below the elevator or in some area where people do not frequent, then it's unlikely that you'll have the virus down there because there's nobody else down there. Those places are probably some of the safest places. Follow the lead of the hospital infection control team with regard to that. So we've discussed face masks, face shields, medical gloves, and so forth. Now, respirators are not face masks, not surgical face masks. They're two different things. And in general, we're currently not recommending respirators. We're not recommending that there's any sort of need for a respirator in this situation. So thank you again for attending this call, and be safe. And if you have any issues, let me know. Until next time, see ya.